This afternoon we're going to now start focusing on the future and how we get there. And one of the ways in which we have looked at doing this is to have produced a draft strategy document, which you should have in your packs. The strategy really is a map, if you like, to help us reach our future goals. And it's been built on what you told us last year, all the foundation research that you were listening to earlier today, the need assessment, and also what evidence tells us about what works. So John and I are doing a double act to outline the proposed strategy, the rationale behind it, some of the challenges we face, and also how together we might tackle them. I showed you earlier the vision, which was really looking at a system to enable every child in Warwickshire to have the best start in life and to achieve their full potential. And to do that, we're looking in the main at a model that will be an integrated model, a lot of which came out of the material this morning. And we'd like to move from where we are now, over here, with lots of different circles of service that's being provided. Some of it does work together already, but we think we can do even more. We'd like to move by October to at least looking at how we can integrate our universal and targeted early help services for 0 to 5s and their families. We also have the exciting prospect of working in an even more linked up way with community midwifery. There are changes going on within NHS and plans there as to how we can look at delivering that or more of it at a community level. So that by 2020, we're able to have a fully integrated service that takes on board the things that we have been learning about today in terms of accessibility. And I want you to please have a look at the bottom half of this document. It looks at streamlining things, having multidisciplinary teams to deliver the service, making it flexible and accessible, sharing standards and pathways, one of the things that came through the work that Sophie was talking about earlier, and also that we have partnerships in delivering that, so that we have an integrated model in the middle, enabling us to deliver both universal and early help services, which are going to then work with improving the way services are delivered, working with our communities so that they're ready to help with children under 5 and their families, and ready children to help us with our good levels of development in the future. At the top of the slide, we're really looking at the sorts of principles by which we work, ensuring that we're communicating well, that we really are joining up the services, that we're being very purposeful. Okay, yes. 2020 might look a long way away, but actually it's going to come to us all too soon. So we need to all be working with pace, looking at how we focus on delivering solutions together and making sure that we're working to develop a very flexible and well-trained workforce. So John's going to now look at the rationale behind that model, and I'll jump up again at the end just to round off.
Thanks, Helen. Can you hear me at the back? Yes? We're on a significant journey together, and for us, very formally, this journey started at Righton a year ago, and so what I'm going to be talking about is where I think we've come, what people were saying then, what you said then, and what we have tried to do then, and also how we're going to take it forward. But also, of course, we're all looking back much further than that. For me, when John and Anne put the slide up saying in 1977 Bowlby was talking, that was when I was in the second year of my social work training, and they were talking about Bowlby as if it was a dramatic new discovery, whereas naturally it was simply the professionals catching up with what most parents had known for many thousands of years. But believe you me, in those days, and to some extent, of course, still, how families were treated and how children were expected to behave in terms of that level of separation from each other was shocking, truly shocking. So, what we've been wanting to do is to build on all of the work that's happened and all the thinking that's happened. We've had outstanding amount of research, as several people have commented on that. The investment that's been put in time and thinking and people working together on this is really remarkable. There's a small point that we're in the time of austerity, and I'll come to that a bit later, but the main thing is these are our children. We need to have a more joined up approach. We need to integrate what's happening in the health service, including obviously those parts of the health service like health visiting that the council now will be commissioning, and also children's services. But we need to have more targeted provision for the more vulnerable while securing that there are still universal services for all children. But we will need to redefine what we mean by targeted services and how we ensure that universal services are available. And as part of that, we need to work very differently with our communities. And we're launching a major program on community capacity building because the different parts of Warwickshire don't talk to each other in a recognisable way. We sit in our silos in the Castle of County Hall, the individual schools, individual organisations, and we don't talk to each other in order to be able to get things right. And that, of course, is the number one thing that staff were saying to our researchers. So out of that, we will be needing to have less focus on designated children's centres, but more on how we support families. I do think, though, that we will be continuing, I'm sure we will be continuing to have the children's centres that we have in the centres of significant deprivation because they get it right, and also where there is a real need. But we do need to talk further about family support, and that was, again, one of the requests that has come through. But in any event, whether it's a building-based service or a family outreach-based service, we need to do a great deal more about community capacity building, and I'm just going to say a little bit about that. Right, and there we are. These are just a couple of slides which are saying what you said last time and what we've been trying to do. And the most important thing is what you were saying last time. You were saying that services are not integrated. We strongly recognise that, and so we're doing a whole load of work around integrating and putting together a new model for how services should be. That's got to be constructed within the next couple of months because we've got to have the model in place before we start going out to look at our resources and how we use our resources. And alongside of that, it's integrating the workforce, developing the workforce, ensuring that we do target services in those areas of highest deprivation, and that we improve access for families who are most vulnerable. The next is the point about inequity of service provision that people have been complaining about. And so whilst we do need to make sure that there are services where they're needed the most, you won't need me to tell you that whilst there are some parts where there is very significant deprivation, there are other parts of the county where there's what I would call pepper pot deprivation. If you live in a rural area and the rest of the population on the whole is reasonably affluent, but you don't have you don't have the money, you don't have the resources, getting access to services is actually sometimes more difficult than if you're living in an area of significant, more general deprivation. So it's about how do we reach out right across our communities and the different types of communities. There's also about having insufficient parenting groups and networks, and that, of course, fits into the community capacity building because the greatest strength and the greatest knowledge is with parents themselves, but it's about ensuring that parents are supported to support each other and are seen as a key part of the overall network of support. The next was about developing future family support services, There's been a significant investment which we are now beginning to deploy on family support services, and we need to ensure that that is fitted into the emerging model that we develop. And then there's mental health and early help needs, and those have been touched upon several times already today. I don't think the future of mental health services development is just about developing lots more Tier 3 services, partly because we cannot afford Tier 3 services, and secondly because we need to be providing mental health support for children and their mothers very much earlier than by the time they're ever going to get to Tier 3 services. In particular, we need to provide a great deal more early mental health support in schools, and we've had some programs here in Warwickshire which have been very, very well regarded, so that generic workers can call upon assistance from mental health professions where needed. And although, of course, it is true that further up the line, Tiers 3 and 4 is necessary, when I tell you that 14% of the entire NHS budget is spent on specialist services, you will realise that we have a major need to melt down some of those services and reinvest them in the community. Right. Alongside of this, I wanted to say something about the importance of community development and community-led services. There is a tendency for professionals to say, we know best, and the higher up the specialist chain we are, the better we know. And that is one of the reasons why Tier 4 services have swallowed up such a huge proportion of the social care, health and social care budget. So they consume about £16 billion a year nationally. We've got to have a different approach, and we've been working with an organisation called NDTI, and we've got colleagues here to say, how can we begin to rethink how we engage with communities? It's about working to build on the capacity and the strengths that we know that people and their families bring, and what is already available in the community. Personally, in another life, I'm involved in 4 voluntary organisations which are not in Warwickshire, helping older people, people with learning disabilities, and a national organisation called In Control, which is about transferring control and decision-making from professionals to communities and families. It's a bit like prizing professionals' fingers off the levers of power, but it is absolutely critical, and in the current climate it is the only way in which we're going to be able to continue to deliver services. And so that's about delivering public funding creatively in order to support those who are in greatest need, but also those who are not in the greatest need, but in somewhat less need before they get to being in greatest need. And so ensuring that our plans are focused in that direction. As far as children and families using services are concerned, it's about the strong belief that the individual, the family and their community have assets that can work well. It's about having an asset-based approach, which we're not good at as professionals, away from a deficit-based approach. The deficit approach is what can you not do, and the asset-based approach is saying what can you do and how can we help you to do that. So there are some key values that underpin that. One is co-production. I think we've tried to do co-production in working with you and others as we've gone through this programme. The next is about it being personal-centred. It's not about one size fits all. It's also about partnership with local people and with our local communities. It's about empowering our staff teams, because a lot of the time, staff themselves are not given, we don't trust staff to go off and do what they know how to do best. And as part of that, it's about reducing bureaucracy. I mean, during the time that I've been working in social work, there's been a shocking increase in bureaucracy. Some of it, of course, self-inflicted. And then I want to come on to something which is important. Sorry about this. which is about the money. Now, this is not about the money as such. All of this is about how we support children and families. It's about how we use the money and the resources and the staff and the buildings in order to get those results, to get better outcomes for children. There is deep frustration, though, that the cuts that there have been in the last 3 or 4 years have simply resulted in reductions in what we've always done. So less opening hours in the children's centres, less staff. So trying to spread what we've got that bit thinner. And people, of course, always will try to do the very best in those circumstances. But it is deeply dispiriting because there's a feeling that in the good old days you could do a lot more. And simply having less has made life really, really difficult. We now are going to have to take out more money. And so the question is, how do we transform our services so that it is no longer depressing working in them and feeling that you are gradually being ground down? So as that is one of the top priorities, we've really got to consider how do we work together as staff, as communities, the council, the NHS, voluntary organisations and district councils. How do we all work together? But the background to this, as you will know, is that the national financial situation resulted in what we called one organisational plan 1 within the county council, and we have mostly taken out the £92 million that we had to do. That is a very big chunk by any consideration. It's much, much more than the NHS, for example, had to do, which has essentially been just a very little bit of increase. We've had to take out £92 million. There is still £700,000 to come out of children's centres because we've been waiting while we plan this work to say what is the best way forward on that. But that money has got to come out sometime. Then, as if that wasn't bad enough, we then had the Chancellor's December statement, which is leading on to current planning, which means another £60 million comes out of county council services. And that is happening alongside the discussions, major discussions that we've got with the NHS that we're involved in, which is saying the NHS has got to cut its cloth. And the NHS in the Coventry and Warwickshire footprint, because we believe strongly in working on a Coventry and Warwickshire footprint, have got to take out £325 million in order to balance the books. So the good news is we've got to plan it together. The bad news is that it's a very big sum. But alongside that, the county council put a strong commitment to saying the 0 to 5 work is fundamental, which is why we're all here and why we've been doing all the work together over the course of a year. We've, as it were, had dedicated the luxury of a year together to think, what are we going to do? And we're now at the point where we're going to have to decide, what are we going to do? And then in February of this year, more money was put in for family support workers. That is absolutely essential. And so we have some resources that we are using. So we're now co-producing the model, and you will have a lot of ideas. We've got a lot of ideas come forward. And today is a key milestone. But this autumn will also be when we come forward with proposals where we've got to take out that 60 million and that 700,000. So it is an absolutely pivotal moment. And the first proposals for that are going to come out to Council on the 22nd of September. And after that, they will become quite widely public. Thank you. Helen, it's yours.
Okay, just to round off from all of that. Okay, thank you. As I mentioned earlier, a strategy really is a map that helps us look at how we get and achieve our vision within the resource and to meet the need that's presented locally. And how would we measure our success? How will we know if we have achieved that? And this is really just to reassure you that we would build into the strategy means of measuring our progress, whether it's satisfaction with services, talking to people who are using those services, understanding the numbers of people accessing services, looking at the long-term impact. At the moment, we know as a benchmark what our good levels of development are, around about 67%. We want to be ambitious and look at maybe 80% by 2020. So we would use that to measure before and afterwards. And there are other measures to look at how we would work and measure the success of working with the community. In our next session, our colleagues, Kate and Kate, will be looking at in more detail what the integrated service would look like and how we might get there. So if I hand over to you.